Hi, I'm Ed Wyluda. I'm a medical oncologist hematologist. I've been at Cape Cod Healthcare since 2020. In medical oncology, we care for patients at various stages of a diagnosis. For example, we could see them before surgery to possibly help and treat, shrink underlying disease to make surgery less complicated. We could see them after surgery to discuss therapies that may help to bring down the risk of recurrence. And we have various medications that can help in this regard depending on the cancer type. Medications that are in the form of pills, infusions, which could be targeted therapies, chemotherapies, immunotherapies. The oncology world has exploded to some extent in terms of newer, more cutting-edge therapies that we can use. We can truly personalize a treatment approach for our patients. Dealing with a cancer diagnosis is a very challenging situation. I feel that at times patients, family, friends may have felt that they have lost control. A lot goes into a cancer diagnosis. There's biopsies, imaging, meeting multiple providers. I can only imagine a lot of stress, a lot of anxiety with this. What I try to do with my patients, their family, and their friends is implement an overall treatment care plan that they feel comfortable with. I feel it's extremely important that they feel comfortable with this. I think it helps to give them back that sense of possibly losing control or lost control in general. I also feel it's important to know that we're here to support them through this, throughout the course of their illness and the treatment for this. I've learned how strong patients are, how resilient people can be. I've learned about how important it is to have support with family, friends, because dealing with this type of diagnosis can be very difficult. Having that support is extremely important. I feel there's a human element to this that's very important, as this can be life-altering, life-changing, and having support is extremely important. There's various tumor boards. They usually either meet every week or every other week, and it has multiple different physicians: medical oncologists, radiation oncologists, radiologists, pathologists, surgeons. We all put our heads together to try and determine the best course of action for a patient. We'll present the case, we'll go over imaging, pathology, and then help to determine the overall plan of care. Well, I've got 3 young kids, so they keep me busy in a lot of different ways. I like to be outside. I like to go for runs. I like to go to the beach. Believe it or not, I actually paint. I do watercolors sometimes. Other things I like to do, just be outside. The Cape is beautiful. I've always loved the ocean. I wanted to be a marine biologist before I became interested in medicine. Being close to the ocean is something that I think helps to keep me more at ease. Going for runs on the beach, just going to the beach, exploring the Cape in general can help me decompress. And then sharing that with my family and friends is a huge plus. I get this question a lot where people say, why oncology? I wasn't initially planning to become an oncologist. I was thinking of going to, for example, radiology or maybe surgery. I was diagnosed with Hodgkin's lymphoma, and at the time, it was earth-shattering. I didn't know what was going to happen next, how I was going to deal with this, how my parents were going to deal with this, or my girlfriend at the time. I didn't know how I was going to respond to therapy or if I was going to go into a remission or cure. I met with my oncologist at the time. She laid out a treatment plan for me. And once we implemented this treatment plan, I felt much more at ease. I had a plan in place. I knew what to expect on treatment day, the day after, the week after. And I was able to get through this process, I felt somewhat quickly. And I realized how rewarding oncology can be. I see with numerous patients a very rewarding atmosphere in oncology, believe it or not. Whether it's seeing someone respond to therapy dramatically and have an excellent response, or someone who you're caring for, you may not be having a great response to therapy, but are managing their symptoms and optimizing their quality of life with the time that they have. I feel it can be a very rewarding position and a very rewarding environment, not only for myself, but for my team. Seeing patients, family, friends doing well in various ways is very important.